Hello guys, I'm Dr. Eric. Today I'm going to take you through a medical condition, peptic ulcer disease. These are the painful sores or ulcers on the lining of the stomach and the small intestine. We have three types of ulcers, gastric ulcer, duodenal ulcer, and peptic ulcer disease. In gastric ulcer and duodenal ulcer, these symptoms comes immediately after 2 to 3 hours after meals. Peptic ulcer disease, these symptoms comes immediately when you have not taken any meals. The risk factors, the people who can get this infection, one, the people who uses pain relievers, NSAIDs, aspirin, brufen, also smoking, the people who smoke and drink alcohol, they are prone to peptic ulcer disease. Family history of this disease, it can run through the family because it's a transmitted infection. This bacteria flows through the blood. The causes, we have NSA, those one are the painkillers, brufen and aspirin. The Helicobacter H. pylori bacteria, these are the bacteria that sticks on the walls of the intestine, causes inflammation and also ulcers. The symptoms and signs, you get the patients most of the time they get bloating, heartburn, epigastric tenderness, also vomiting, dark stool called the melena stool. So you find that these are the symptoms, and the main symptoms, which is chronic, severe peptic ulcer disease, is vomiting of the blood. So you find your patient has these symptoms, uh, you get that it's a serious chronic, it's going to a chronic infection. In investigation, for severe peptic ulcer disease, do an OGD or abdominal CT scan so that you can find the extension of the ulcer and also the location of these ulcers. For the medical, you can do H. pylori antigen, which you use tool, and also if the patient has not been treated for this infection, just do an antibody so that you can start on medications. Complications, bleeding, and also vomiting, perforation, the ulcers are extended and we get perforation. So there is pouring of gastric contents. Also, intestine outlet obstruction. You find when you get inflammation in the lining, you get there is a blockage. So there is no flow of the gastric contents. On lifestyle, just avoid stress, avoid fibrous foods, githeri, sukuma wiki. You avoid spices foods, oils, this one, pepper, you avoid those ones. Skipping meals, we advise on patient not to skip meals. And also avoid late night snacks because it aggravates these pains. And on drinks, avoid carbonated drinks like Coca-Cola, Lucozade, Ribena. You avoid those ones. Foods to avoid matoke, githeri, sukuma wiki, the foods that contains more of fibers because they need more acid to be digested. And also fruits to avoid, unripe mangoes, oranges, lemons, they are more acidic. Drugs to avoid brufen, aspirin. So those one, they erode the intestines. And also we advise you on taking over of foods that help the ulcers to get healing, like yogurt, friendly yogurts, the fruits that are not acidic. Cabbage, spinach, they help on healing of these wounds. So if you are watching this video for the first time, please subscribe so that we can get more information from this channel.